Hi, Grade 9. It's Mr. Blue here. Today, and I guess for the rest of our unit, we're going to be talking about the body's defenses to disease, which is really, really important, obviously, at the moment. I'm sure you guys are seeing these things in action as we're taking preventions with COVID 19. We talked about this in a little bit before we left. Obviously, that's now a few weeks ago, so let's rehash a few things quickly. Um, the first thing, right, is your body has a first layer of defense to pathogens. Now, what's a pathogen? A pathogen is a thing that can cause your body harm. So the common ones that we looked at in class are viruses, bacteria, and fungi. They're the three main ones. There's a few other subsets, but we'll stick with the main three. And basically, those things are going to get into your body and cause you harm. They get into a part of the body where they shouldn't be. The first step is to not get them into that part of the body. So obviously, the first layer of defense and the best one you have is your skin. Okay, it's perfectly set up to keep these pathogens out. What happens if you crack your skin? Then your body forms a scab. And will seal that up so things can't go directly into your bloodstream. You also have lots of what we call mucous membranes, and that is, let me just use my little tool here. That is this one. That didn't work. That is this one right here where my pointer is. Mucous membranes. So mucous membranes are things like the basically mucus inside of your nose. So you'll have things like that. You'll have a lining on the inside of your esophagus, not your esophagus, and your trachea as you move down towards there. Excuse me. So they're the main ones there. You also have your stomach acid, which is in terms of breaking down things that probably should end up in your stomach. So that's the first thing we call the non-specific immune system. Let's just stop it from getting in first of all. But the second one is basically your second line of defense, and that's over here. And that's where we start to see some of these big complicated words, phagocytic leukocytes. Okay, all that means, fancy words, is just white blood cells. Okay, basically, the second immune system is something has gotten into your body and we need to fight it. Now, most of the time, you know that you're going to be going through this when you get your glands swell up. So the main ones here is you'll have your thyroid glands, and they're going to be producing large amounts of these things, these leukocytes, in order to fight this disease. So because they're working in overdrive, they're swelling up. So we get the swelling of these things here. You'll commonly also see them here, and also in your groin. I'm not going to get up and show you that one. Okay, so basically what will happen there is these white blood cells will rush to the site and they will basically come in and try and destroy these pathogens. We're going to look at the process in a little bit more detail, so I'll just go over to my next tab. And this is basically what's going to happen. So we have white blood cells in our blood system, and they're going to rush to the site where those where those pathogens are present. So for instance, these being produced maybe here in your lymph nodes, but maybe, for instance, you've got some staphylococcus in your throat, so just down here. So maybe these white blood cells are rushing to this part in order to fight the early stages of the infection. And basically what will happen is they'll just come in and try and engulf those cells. Now, here's what I mean by this. We'll have, here's our white blood cell, or phagocyte. That's just a technical name for it. Don't worry too much about it. Phagocyte. And basically what will happen here is these guys have these particular things called digestive enzymes. So digestive enzymes basically mean, enzymes that are designed to eat things. What are they going to eat? Hopefully they're going to eat these things called bacteria on the outside here. So this is a type of bacteria, a pathogen, which may be causing your body harm. This is going to be difficult for me, isn't it? Stop making me subscribe. There's no way I'm paying for this. Okay. So, what's going to happen, right? is we get the white blood cells rushing towards these things here, and basically they wrap around it in a process called endocytosis. So there they are, they wrapped it around it here, and now they're going to eat this thing up. So what's happening there is that those bacteria are inside of there, and those digestive enzymes are breaking that down. So this is our second layer of defense. They're then going to spit that section out. Oh, you'll see it on yours. For some reason, I've watched this now too many times, and it's asking me to subscribe. But what's going to happen is it's going to those little residual bodies inside of there are going to be spat back out onto the outside here. And basically, what that is, what the leftover of that is it's pus. So we know our immune system's working really, really well when we actually end up with residual pus. Because once this is done, they die. Okay? Both the white blood cell and hopefully the bacteria will be dead. And the leftover residual of that is pus, which is how you know your immune system's working. So that's our second layer of defense. And it's not specific. So it just means it's just going to come in and it's just going to eat any pathogen it sees. And this is your body's, once a pathogen gets inside your body, the first layer of defense has failed. Your skin's failed, your mucous membranes in your throat's failed, your stomach acid's failed. This is the next step. And it's non-specific because it just does it for everything. All right, hopefully that explained a little bit. I know this is a little bit complicated to be doing via video, but we will try. Lovely talking to you. If you've got any questions, feel free to arrange a Microsoft Teams schedule. We can have a conversation. As I mentioned before, I'm on lockdown here, so it's all good. See you guys.